Thanks everyone for joining us. I know clinic life is not um, easy. It doesn't hand out 45-minute breaks, and the fact that you're here says a lot. And we really appreciate everybody for making your time with us for today. So, whether you're managing the chaos from front desk or like just managing it from tipping over, or you're making high stakes decisions from the top, we're all in the same storm. And that storm, it's called admin overload. And we're going to talk about how we will handle that in 2026. Because 2025 showed us there were a lot of MBS schedule that has changed, CDM rules tightened, privacy reforms were added with a whole new layer of risk and responsibility. And with AI coming into our workforce, it's like a lot of things that you have to manage at the same time. And from what I'm hearing from clinics who are probably just like yours, it sounds like people are overwhelmed, things are a bit slipping, and admin is bottlenecking care. And if that sounds familiar, then let me tell you right now, you're not imagining it because the pressure is very real. But the good news is, this session is not about updating you on what's changed because you probably had skimmed over the RACGP summaries already. We're not here to talk about what are the new MBS changes in 2026 because I'm sure you've already had that one page of summary from the RACGP. And we're not here to talk about those panic inducing emails from your software provider. We're not here for a 2025 recap. We're here to make it real and, more importantly, to make everything manageable because we'll talk about what are some of the pressure points that you're seeing, why does admin feel heavier, and how some of the clinics right now are turning this mess into a momentum because we're going to talk about better patient flow, smarter CDM revenue, and less stress on your team so that no one is running around chasing compliance fires at 5 p.m. on a Friday. So, if that sounds like something your clinic could use, then let's dive in. Of course, let me introduce myself. My name is May, and I am the head of training for GP Hero. And I've had the privilege of working with hundreds of clinics across Australia. My job is to train, guide, and troubleshoot alongside healthcare virtual assistants who support teams behind the scenes and to turn chaos into clarity, especially when systems and rules keep shifting. I've sat with practice managers who are one inbox away from burnout. I've watched brilliant GPs get tangled in admin, compliance, and missed CDM opportunities. And I've seen what happens when the right support meets the right process. And that means patient care is improving, revenue goes up, and your team gets to breathe again. I didn't come here today to drop theory. I came to show you what's working on the ground, what's helping clinics actually adapt to any new changes without losing the rhythm. So, when I walk you through the bottlenecks and the fixes, just know that everything that I'm about to share comes from real teams, real workflows, and real results. So, let's talk about 2025. You've probably heard a lot about MBS has the new rules or anything about CDM. There were MMR's eligibility that was tightened. Uh, the telehealth consultation had a lot of like ups and downs in 2025. And more importantly, there were added weight on privacy, data handling, and consent, especially with digital records and third-party support like AI. And for a lot of clinics, practice software updates have been made things easier. Instead, it has made them feel more clicky. But the kicker is what happened in 2025 is not just minor updates. They weren't just minor admin updates. The changes that took effect back then has affected who you can bill, how you would structure your appointments, how long your team spends chasing paperwork, and how many patients fall through cracks if your process isn't right. It's like you're trying to play the same game, but someone changed the rules mid-season and only gave you a two-paragraph memo to figure it out. Now, to fully talk about that, let's zoom in on where the pain points are showing up and how to tell if your clinic is just surviving rather, or if you're silently slipping behind. Because admin used to be busy. Now it feels like it's bloated and you're not imagining it. You're not overreacting to things because the clincher is the impact is not just internal. These bottlenecks were present in 2024. It's present in 2025 and it's going to be more present in 2026. And the thing about that is any bottlenecks shows up in patient experience. And for us to really like see how that's, how that really plays in clinics, what do those admin bottlenecks look like? We'll use a very simple yet very powerful tool. I call it traffic light check. And I always do this with our partner clinics who are having a hard time managing their internal teams or managing anything in the clinic. So really simple. You can either just going to go ahead and admit some people here. You can just really think about three colors. You have red, orange, and green. So when we say red, it means that it's chaos. Everyone's overwhelmed and there is no systems. Everything's just reactive. When we say yellow, it means that you're just holding it together until someone's sick or the system breaks. So you don't see that consistency. It's up, it's down. And then when we say green, it means that things are running smooth, you are consistent, and everything is just under control. This is just a quick and honest look at your admin flow. No fluff, just real talk. So you can either have a pen or and paper with you, or you can just mentally do this with me. So what I'm going to do now is I'm going to go ahead and walk you through in some of the common bottlenecks in clinics, and what you're just going to do is color it based on what the color represents. So let's talk about referrals and results. Are they being tracked and followed up automatically, or is it sticky notes and memory games? So red for it's messy, yellow for it's not consistent, it's wobbly, and green for it's very solid. You've got it all covered. So I'll just give you 1 or 2 minutes to like think about that. All right. Then let's talk about patient follow-ups. Do you have a system that works every time, or do your patients fall through the cracks? Red, yellow, or orange? Okay. And then what about your inbox and phone management? Is your email inbox cleared daily, or it looks like a war zone right now. And with regards to your phone calls, are your calls answered consistently and professionally, or is it a hit and miss, especially during peak hours? Red, yellow, and green, or green rather. All right. And then what about billing and Medicare? Is your billing clean, compliant, and up to date? Or does it feel like it's a ticking time bomb? Red, yellow, or green? Okay. And then finally, staffing, onboarding, and your handover. When someone leaves or joins, whether it's a new doctor or it's your admin team, do things keep moving or does the system fall apart? Red, yellow, or green? All right. So take a deep breath. Now, if you had your colors on a paper or if you have it mentally, look at your light board. If you're seeing a lot of red or yellow, that's not failure. That's a clear sign that there is room to grow and you're not alone in this journey. More importantly, you're exactly where you need to be to start fixing it. Let me tell you what I just heard last month from one of the practice managers who went on a clarity call with me. One practice manager had been doing their phone calls, follow-ups, chasing pathology result, and trying to onboard a nurse all at the same time. The result of that is patients were waiting and the systems were cracking. Now, to the naked eye, it would look like that's a busy routine. But let me tell you right now, that is not busy. That's a breakdown. And it's happening more than you think. So let me tell you this, if your clinic is sitting mostly in red or yellow, let's not leave it there. Because what you can definitely do right now is jump on a short clarity call with me, just like what that practice manager did, and that's where I'll help you pinpoint what's really causing the bottlenecks and sketch out a clear path to get you to green. Because I'm sure as you're looking at your mental workload and you're seeing a lot of red and yellows, you definitely want to go into green. And because you showed up today, you'll get a free access to our clinic admin templates and our task delegation toolkit. It's a clinic's first aid kit, minus the band aids and all strategy, but that only is available when you book a clarity call during the webinar. Our team at GP Hero is going to drop that link into our chat box so you can grab a slot right now or right after the Q&A, because if you don't fix this now, it'll cost you more later in time, in stress, and in staff. So don't wait for the fire to get bigger. Let's fix it while it is still fixable. So again, the link is in our chat box. Now, let's talk about the biggest trap that clinics fall into when they try to fix all this on their own. When you're seeing a lot of red or yellow, automatically people would think that if we just hire one more person, things will get better. Oh, we're scaling up, we're growing, we need one more person in our team. And maybe you've thought on it and you've acted on it. But that's sorry. But here's how that story usually ends. You bring someone in, you train them from scratch again. There's no clear system, so everything leaves in someone's head, and then they leave. And just like that, you're back to bringing someone in, training them again from scratch, and there's still no clear system. So that means everything just leaves in someone else. Now, what that means is you're stuck, you're overloaded, and you're picking up the pieces again. This isn't a staffing issue, it's a system issue. You don't have a headcount gap, you have a repeatability gap. And in this modern age, anything that is repeatable, when you don't have a proper system in place, you will crash down. And until you fix that, your clinic will keep bleeding time. Your clinic will keep on bleeding energy. Your clinic will just keep on bleeding money. And every single time someone walks out of that door, it's still the same circumstance all over again. Now, if you can imagine with me, think about the last admin who left. Anyone in your team. It can be recently, or it can be someone you didn't expect to leave your team. When they left, was there a playbook to pass on, or did everyone just panic, cover what they could, and pray that it didn't fall apart? Because I'll tell you right now, this is not about blame, it's about breaking the cycle. And the only way to break a cycle is when we can be honest about our situation. My favorite motto in life is that if you can name the problem, you're already solving 70% of the problem. And that's what we're doing right now. We're naming the problem. So the question then becomes, if hiring is not what fixes the admin bottlenecks or whatever it is that's causing your clinic to crash, what then fixes it? I'll tell you right now, it's not more people. It's a system that can carry the weight with or without the people. And we'll get into 3 things that actually change the game. Let's start with what I call my iceberg. So what we all want. So when we say we have a lot of things that we have to do, we want to scale up, we want to open a 3rd location, automatically we're thinking we need more warm bodies. But I'll tell you right now, warm bodies is not actually equivalent to a future-proof business. It's just the tip of the iceberg. If you want to go deeper and ensure that your foundations are solid, then you want to be thinking about your structure in terms of scalability, in terms of fixing the admin bottleneck, in terms of ensuring that your team has room to breathe and that they are doing the job that you paid them to do. Like, you're not expecting a doctor and you're not paying a doctor so that they can chase pathology results. That's not what you hired them for, right? So what you need in order to build that gap into a future-proof business is structure, meaning clearer roles, right people, right work, and then system wherein processes that aren't person-dependent, and structures, which means tools that simplify and not overcomplicate. And that's how you get into a future-proof business, because your clinic is like this iceberg right now. What's visible On the top of the iceberg, that represents calls, admin load, daily fires, and that's just the surface. But what's really holding it all together, it's what's underneath. Now, if you don't have anything underneath that, then perhaps that's the reason why everything is chaotic, or you're not seeing the consistency that you need. So take a look at the iceberg right now and ask yourself, are you constantly patching up the surface without reinforcing the foundation? Because that shift in thinking, that's the difference between constant stress and real stability. And like I said, this isn't just a nice theory. This is what we do every day. We help GP clinics across Australia build a strong foundation that won't crack under pressure. And we're going to break that into our first layer right now, which is structure. So this is where most clinics would feel the first pinch, which is the team. Because you look at your team, you've hired smart, capable people, people with good intentions, people with good instincts, but what are they doing every day? Chasing results, faxing paperwork, there's manual data entry, doing recalls, handling phones, following up on patient, and sorting Medicare claim confusion. None of that needs clinical judgment. And none of that is why you actually hired them. Maybe you've hired them for some of those, but not for every repeatable task. And that's not admin. That's actually admin bloat. And the worst is it's burning your team out. We've seen great people quit, not because they were not doing a good job, but because they were stuck doing the wrong job. Like, you see the potential. You see that this person can grow into maybe even your assistant as a practice manager, or even if you're an owner right now, growing into the practice managerial role. But the thing is, there's just really no room for them to grow because they're stuck doing all of the admin paperwork. They're stuck doing helping your receptionist, ensuring that all phone calls are covered. Now, take a second, and you don't need to answer this out loud, but how did it feel when the last person, or when the last time that somebody left your team, whether that's clinical or it's admin? Was there a clean handover, or did you just scramble to cover the fallout? Because what I hear from practice managers who go into a clarity call with me is that they are managing the business, but at times they find themselves working in the business, meaning covering for receptionist roles, covering for any admin bottlenecks, ensuring that no Medicare claim is missed. And they will tell me and say, it feels like it's part of my job, but it's not actually part of a manager's job. Maybe the reason why a lot of practice managers are still doing that is because you don't have a system that actually backs you up. The truth is, more staff doesn't equate to more capacity. And I need you to wake up into this truth right now. You're not just looking to hire more. You're not just looking to hire one more staff. You're looking to breathe wherein there's fewer things slip through the cracks. There's less front desk overwhelm. And you have a team that's not running on fumes every single week, because the default response is always, let's hire one more person. And when that is always your response, I'll tell you right now, you're not scaling, you're just patching. And when you do it without structure, you don't increase capacity, you're just increasing the noise. What does real capacity look like? I'll tell you what it looks like. Real capacity means roles are very clear. Handover doesn't fall apart when someone's off or someone's sick. And every person is set up to succeed, not to survive. You know how, like, you're doing hiring, somebody comes into your work, into your clinic, and you will say, this is the things that we do here, and well, good luck. I wish you good luck because the last admin person didn't like has quit us in just under 3 months. How did it feel? Like, does it feel normal to say that in your clinic, or is it maybe a wake up call to you right now that this is not how things should be? And if you've ever said that, don't worry. Like I said, you're not alone. You're not imagining the churn because it's a structure problem, not a staff problem. Now, what if instead of scrambling to backfill every time someone leaves, you had a trained team ready to go, understands GP life, and is a plug and play system? Because that's what we are built for. We are built for recalls, referrals, results, phones, invoicing, Medicare staff onboarding, anything that is a bottleneck in your clinic. GP Hero is built for that. Our theme just doesn't lighten the load. We know the load because we're highly trained for it. And the kicker is, for less than a cost of one in-house admin, you get a trained team that doesn't burn out, doesn't need constant retraining, and that doesn't add to the noise in your clinic. And that's not spending, that's actually smart scaling. Let me ask you, if you could take one admin bottleneck off your plate next week, which would it be? Whatever your answer is, GP Hero, I'm confident to say that GP Hero is your solution. So what does it mean in action? Meaning we handle the admin so you can focus on patient care. So when we say we manage your admin, it means you're getting your time back as a practice manager, as a clinic owner. Your focus is back, your sanity is back. And most importantly, your team gets to work at the top of their game, not just ticking boxes all day. To go back to our foundation, our mission is very simple: to empower Australian GPs by taking the admin burden off their plate without compromising compliance, quality, or care. And we don't just train our team on the job, we train them into the job. That means our team has a deep understanding of RACGP expectations, Medicare workflows, and local clinic pressure points. When you're hiring somebody from GP Hero, you're not having to teach them what is a referral, what is a result, what is or how does customer service look like in clinical setting. You're not having to do that. Your only hand in this is to clearly express, to clearly describe what does done look like for you. And that's a job that a practice manager or a clinic owner must do. And perhaps the reason why you're not able to describe that properly to your team is because you haven't had your focus on it. Like, ask yourself right now, what does done look like to you? Have you told your team about what does done look like for you? Because if not, then I'll tell you that your focus is not yet there. And GP Hero is a system that can back you up to ensure that your focus is back. Now, what it means is you're not just getting a VA, you get a trusted team member, because we vet every GP Hero VA with thorough background checks. We have our skill testing, and we have our own privacy and security training. All this happens before they are ever sent out to clinics for candidate selection, so that when they join a clinic, you're not just crossing fingers, you're already confident. And we are like I said, we are plug and play. So these are some of the roles that we're ready to plug into tomorrow. You have admin support, people that can help you with your administrative tasks, whatever that is. Is it referrals? Is it result? Is it managing those missed opportunities inside Cubicle? Then we have our admin support for that. We also have appointment book manager, people that can ensure that your appointment stays afloat, people that are coming in tomorrow has a validated Medicare, a validated IHI, and of course, our receptionist task. We don't need months of onboarding. We're trained, we're ready, and we're yours. So now that is what we call structure. That is how you see structure. And now that we have talked about it, the who and how of your team, let's get into the glue that holds it all together, your system, and why most clinic gets it wrong. Now, talking about process, hiring the right people is just the start, right? What your clinic really needs is a system, one that's documented, delegated, and disaster proof. So ask yourself this: if your best receptionist walked out tomorrow, would that workflow hold? Or would everything crash? Your inbox, your phones, your follow ups, because no one else knows how this all works. This is where most clinics would get stuck because operations are built on people memory, and it's a mix of sticky notes, it's a lot of shoulder tapping and best guesses. That's not a system, that's a gamble. And when things break, it's not a mystery, it's baked into the setup. So how we shift that into one solution at GP Hero, we flip the script, meaning every task is documented, every workflow is owned, not by one person, but by the system itself. So that when someone walks away, nothing falls over. When someone leaves, you don't rebuild, you just plug in and keep on going. Because what you really need isn't more hustle. You need a repeatable systems that creates reliable workflows. At the end of the day, you just need a process that just works, meaning process or task gets done, patients get followed up, nothing falls through the cracks, there's no surprises, there's no scrambling, and just reliability. And that's what we exactly deliver with trained VAs, clear workflows, and zero guesswork. So when we say repeatable workflows, when we say trained VAs, when we say zero guesswork, we mean admin gets done the same way every time. We are not generalists. We are healthcare trained, clinic ready admin professionals, and most importantly, zero guesswork. Meaning you don't have to train from scratch. You don't have to micromanage. You don't have to cross fingers and hope that someone gets it. We build the system with you so that it runs with you or even without you. So that that long planned vacation can finally happen because you have a system that runs without you. When was the last time your admin could really run without you? Ask yourself that. Was it the first year that you opened the clinic because it was just a slow season? Because that's a real test of a good system. Repeatable workflows, trained VAs, zero guesswork. And now you're thinking, this all sounds great, but like I know that I need a system. I know that I need that structure. And I am thinking about getting a VA, but is it secure? Can I really trust this with patient data? Let's talk about something that we have built that layer in from day one, our data privacy and compliance. So what matters just as much as efficiency is privacy and compliance. You're dealing with sensitive patient data. and we treat that with the seriousness it deserves. Meaning, our VAs complete rigorous data privacy training before ever stepping into a workflow. They're trained in Australian privacy laws, patient confidentiality, and secure communication protocols, because this is not something that we bolt on later. This is something that we baked in from day one. Because for GP Hero, you should never have to choose between support and safety. With GP Hero, you get both. And we don't stop at training. We protect your practice with real safeguards, which is both legal and financial. We have our own insurance and liability. We have our own professional indemnity insurance, our own cybersecurity insurance, because we don't just provide trained admin staff, we also protect the clinics that we work with. We have around 100 plus clinics. I think our head count right now is 110 clinics that works with us. And they're secure, not because somebody is doing the job with the done that they have described, but also the partnership that we have built has been covered by professional indemnity insurance, our general liability cover, and formal agreements that outline confidentiality, compliance, and accountability. Meaning, no gray areas, no risk unleft covered. You're not exposed, you're not flying blind, you're covered the right way. And if you've ever hesitated to delegate admin because of the risk, this is the piece that changes that. Our insurance and liability. Now, let's get practical. Let me show you what exactly our VAs takes off of your plate every single day. And I call it our ultimate task checklist. Now, as I've said, we can handle basically everything that bogs you down, whether it's phones, inboxes, recalls, billing test results, reporting, even those little admin tests that you forgot that you're still doing, we can cover it for you. Unfortunately, we don't have the time to do it right now because it's a lot. But what our team at GP Hero is going to do is going to drop that link into our chat box so you can see our ultimate task checklist. But if I can just sum it up to this, anything that can be done virtually is a thing that we can do. Our people are not just boxed with the day-to-day clinical things. We have people that are doing executive assisting for doctors, people that are doing social media, people that are doing website management for some of the clinics that we work with. So that link is in our chat box right now. Take a peek, scroll through, because you might find yourself thinking, GP Hero does that? We definitely do. If it's on the list, then we definitely do that. If you're unsure if the task that you're doing in the clinic is something that we can do, then what you can do is book a clarity call with me. Let's talk about it. It's just going to take 15 to 30 minutes of your time. And that link to book our clarity call is still in our chat box. Now, all this is great, but let's talk about your tasks as a practice manager, as a clinic owner. What about you? Where do all this covering gets to you? Well, let me tell you right now, this is always an exercise that I do with our partner clinics. I call it my delegation exercise. So even what I find is that even with the right system in place, with clear processes, with proper workflows, there's still one thing that can make or break the whole setup, and it's the support. I don't just mean more hands on deck, but I mean support that gets to you as the practice manager, as the clinic owner. So what we're gonna do right now is we're gonna do 4 baskets. You can write this in your piece of paper, or you can just take a screenshot of this right now so you're guided and do it after the webinar. So in the 4 baskets, I'll walk you through each of them. You have the first basket, which is don't know how to do, don't want to learn, but you understand that this is essential to your clinic, especially in modern age. These tasks can contain, most of the time when I do this with practice managers, it contains a lot of digital marketing. So social media, um, marketing through your website, ensuring that it's up to date, because maybe your website still has a doctor who has left your clinic last year. So things like that, most of the time I find is something that practice managers or clinic owners would tell me that you don't know how to do and you don't want to learn, because in reality, you don't have the time to do it. Maybe it's an AI that you've been planning to invest, but you don't have the time to learn. Or is it maybe another CRM, go high level? Or maybe you have Cubicle sitting there, but you've never fully learned it. I just spoke with one practice manager who told me, you also handle missed opportunities inside Cubico. And I was like, yeah, we have a lot of people that are doing that, who are looking at your potential 109 and sevens, looking at your potential MMRs, looking at your potential CCMs. We have a lot of people that are doing that. And that's just an untapped opportunity for them that has been sitting for more than a year already, because in reality, she didn't have the time to learn. Maybe that's you right now. So if that's a task, you put it in the first basket, don't know how to do, don't want to learn. The second basket is don't want to do and don't enjoy doing. I've spoke with a lot of practice managers, and I'd say only one person who has told me that they enjoy chasing debtors. Now, if that's someone like you have a lot of tasks that you're doing, but you find that you don't actually want to do them. You don't enjoy doing them. You don't enjoy covering for phone calls. You don't enjoy scanning and allocating documents. You don't enjoy chasing after referrals. If that's you, go ahead and write those tasks in here. And then the third box is don't have time to do. So these are the tasks that is still on your to-do list from 3 weeks ago, and 3 weeks after, the mountain just keeps on rising. So if it's a task, then you put it in, don't have time to do. And then what I need you to really focus on right now is tasks only you can do, literally requiring your face and your voice. Now, I'm going to drop a bombshell right now. If you're a practice manager, if you're a clinic owner, these tasks should only be 5 to 7 tasks only. 5 to 7 tasks. Now, you're going to look at me and say, I don't do 5 to 7 tasks, I do 1 million tasks. Then perhaps it's a time to pause and reflect. Ask yourself, list it all down here first in the tasks that only you can do. And ask yourself, is it really something that you cannot delegate onto? Because maybe things that you're doing in the task that you think only you can do is actually a task that you don't have time to do, but actually can delegate onto someone else. Or maybe it's a task that you don't want to do. You don't enjoy doing it, and yet you actually can delegate it. Now, when you have that enlightenment, I'll tell you, you will see that there is a lot of things in your plate that is ready to be delegated to someone else. And if you're confused, you're not sure, I'll tell you one thing that you can do: book a clarity call with me. We'll walk you through anything that is on your plate right now. Okay, so that's our delegation exercise. Now we move to our last of the pillar inside our iceberg, which is support. Again, it's not the tool, it's how you use it. I've spoke with a lot of practice managers who tell me that they think they need to invest in one more AI, they need to invest in one more CRM. I'll tell you right now, without the right kind of support, without the right kind of support, without the right kind of system, without the right structure, a new tool is just an equivalent of a new hire. Instead of creating capacity, it will create noise. So when we say support, I don't just mean more hands on deck. I'm talking about the kind of support that scales, automates, and actually lightens the load of your team. So let's unpack how real support looks like for a modern, high functioning GP clinic. Now, it's very clear technology is not slowing down, especially AI. And it's moving fast, and clinics that don't keep up are left with expensive systems that sit idle while teams drown in manual work. And at GP Hero, we don't just hand over tools. We build smart, streamlined workflows that works around the platforms that you already use, meaning you're not having to teach someone what buttons to click because we've already trained in best practice, Cubico, Hotdog, and AI is our second language, meaning AI is integrated into our workflow. It helps our cognitive load be faster, but still, your VA leads that, especially right now where there is still no clear protection and restriction in AI across Australia. You need a human body to ensure that the AI is behaving as expected. And that's what we do. We connect the right people to the right tasks. We cut out double handling and use AI to automate admin that doesn't need human hands. Real support isn't just about access to technology. It's making that technology work for your team right now. So when we say support that executes, we're not meaning more tools. We're asking, can someone just take this off your plate and actually follow through? Because the truth is, support that needs hand holding is not support. It's just another job that you have to manage. Clinics want someone who sees the job, owns it, and finishes it without the back and forth. Because, a lot of practice managers would come and tell me, we want someone who's confident but is never afraid to ask questions. Now, you clearly define the boundaries. When you say my office is open for everyone, do you really mean that? Do you want everyone, when you assign a task, come into your door every 5 seconds just because they're not sure? You don't have a system in place that fully supports them. You don't have the right kind of support that truly holds the fort. Because if that's like that, then I tell you what you have is a back and forth, Not let me check with the team, just following up again. It's just done because this isn't about assigning tasks. It's about executing with ownership. So the real question that we ask every client when you come on onboarding call, what would it feel if support didn't add weight but lifted it? And that's where GP Hero comes in. We offer ownership, execution without excuses, meaning we don't just answer phone calls, we don't just take notes, but we're outcome-driven individual every time. We understand the impact of not doing things correctly. Because when we train our staff, we're not just training them on the tools, we're not just training them on step 1, step 2, and step 3, but we're training them to see what happens if you don't do step 1 correctly. So we train our people to take initiative, not just instructions, because you don't want someone who comes to you with a lot of questions. You want someone who would go to you and say, this is a problem that I see. Here are 3 solutions that I think would fix this. And my recommendation is this solution. Somebody who takes initiative, somebody who thinks like operators, not order takers, and somebody who moves with urgency and not delay. And we pair that mindset with smart systems, AI-assisted workflows, task tracking, and automations that remove the noise and double handling. So when something lands on your desk, on our desk rather, when you hand over a task to us, it leaves your cognitive load. simple, clear, done. Because great support doesn't slow you down. It gets ahead of you. It takes the admin with it. Now, when you integrate this deeply into a clinic operation, trust becomes non-negotiable. And we've already highlighted this in the systems discussion, but especially in support, we're talking about technology. And with us, enterprise grade security is something that we have built in. It's not bolted on when you sign that contract with us. So when clinic trusts us with patient data and operations, we don't take that lightly. Security for GP Hero is not just a checklist, it's a system-wide standard. Meaning, our security is baked into the infrastructure. There's end-to-end encryption or encrypted communication, role-based access and secure login protocols, real-time activity monitoring, and regular internal audits and daily backups, because we have our own team of support. We have our team of IT professionals. We have our team of team leaders and quality analysts that's going to ensure that this is all backed out and everything is working as expected. Every VA, every tool, every process, we have designed it to protect your clinic, your team, and your patients. And we've supported hundreds of clinics in Australia, from solo GPs to multi-site practices, because our team, or our systems rather, has been tested under real pressure, refined continuously, and audited to meet high clinical standards. You focus on care. We handle the back end with bank level security. We've shown you how we build capable teams. We've shown you how we designed secure systems, and we've shown you how support with smart tools is actually a game changer. But don't take our word for it. Look at real stories from clinics who, just like yours, trusted GP Hero to take on key parts of their operations and saw the difference in time saved, stress reduced, and patient experience improved. So this is a story about a hands-on GP owner who wanted to lead better, not just survive the daily chaos. So when we were on that clarity call, what struck me is that he said, I was constantly covering reception gaps. I was constantly chasing pathology results, and I was constantly staying back late. And he knew that this isn't sustainable, not for him and not for his team. So one of the biggest challenge, and the reason why they went into the clarity call, is that their most experienced receptionist, who was holding the glue together, went on leave. She went on a maternity leave, and suddenly gaps were everywhere and nothing was documented. So what changed is that they onboarded a GP trained VA to step into key admin tasks, and then we helped them map and document critical workflows, especially recalls and results. And then the team learned how to delegate non-patient facing tasks confidently. So the impact of that, in just a span of 3 months, they were able to reclaim 12 hours per week of high value reception time that was meant to be for people that are coming in your door. Ask yourself, when someone comes into your clinic, how long does it take for a receptionist to greet them properly? Now, for that clinic, in 3 to 6 months, we were also able to create documented process, so there is no more one person bottlenecks. And in just they've been with us for, I think, running 2 years, or 1.5 years with us now. When I just had a recent catch up with him, he said, I get to lead again because our front desk isn't just a fire to put out. It's a system that works. And that's a story of a GP owner in New South Wales. And then we have another clinic in Queensland. It's a story about a proactive manager who knew their team was capable, and they just needed the right support. So they had great tools, but the staff was, it was clear that it was really drowning. They were drowning. And it wasn't about working harder, because she looks at her team and she knows that her team is really working hard. It's about designing a smarter system. So the challenge for her is that, in spite of having best practice, in spite of having hot dog cubicle, and they even invested into an AI phone triage, the team was still re-entering data manually. So when it's like that, burnout was rising, and then turnover happened as well. So what they did is that they brought in two GP trained VAs. Take note, this is not a single located clinic. They have 3 sites in Queensland, and they have more than 30 doctors that works with them. So what they did is that they are a super clinic to begin with. So they brought in two GP trained VAs for inbox and follow-ups. And then we co-designed smart documented workflows for nurse messaging, recalls, and scripts. And then they optimize their existing platforms instead of adding more complexity. So the impact to that, in just 4 months, and this was before AI was already in place. I think it was back in early 2023 that they were with us. So in this span, a few months that they started, there's already 75% reduction in double handling. And for the first time, admin KPIs were tracked and improved, and the team morale lifted because staff felt seen, staff felt supported and scalable. When I had a catch up with her, she told me, whenever she sees her staff walking in the front door, she almost feels like there's a breath of fresh air that comes with them, because the workload is lighter now compared to before they started with GP Hero. And that's a story of a practice manager from Queensland. Now, take a deep breath, because we've covered a lot in this webinar. We've covered about chaos, we've talked about solutions, and the real clinics like yours, and how it has achieved. So I want to ask, and you don't even have to like share it with me right now, but if you want to share, that would really, really be great. If you just, what's important to me is that you're learning something. So what's one thing that hit home for you? Maybe it was when we were talking about a pain point that you're living in daily, or maybe it was a system that you have putting off, or maybe it was the idea that you don't have to do it all for yourself. So what's one thing, one insight that hit home for you? So again, if you're open, pop it in the chat or jot it down later, because to me, this session is equally important to learning, because this is your aha moment. This is the aha for you. And that's where transformation begins. Now, what's one action that you want to take right now when you're realizing that, sorry, when you're realizing that you don't have to do it yourself, or you're living in a pain point, or you have a system that you've been putting off? What is one action that you want to take? Because in this webinar, you've seen the gaps, you've felt the pressure points. The question is, what are you going to do with that awareness? What's one action that you can take from firefighting to flow? If you're not sure, then I'll tell you where exactly to start the clarity call. It's free. It's not even a sales call, no fluff, and it's built for Australian GP clinics. We'll walk through what's happening in your clinic, pinpoint the breakdowns, and map out a path forward. And if we're not the right fit, you still walk with a tailored action plan you can run with. That's the promise. Because I'll tell you, if you don't do anything about your reds, about your yellows, or about that pain point right now, that same face of red, that same face of yellow, that same face of pain point is still going to show up because you didn't do anything. But maybe you're asking, I don't know what to do. I don't know, like, what's my next step from here. Book that clarity call. And again, you can scan the code, or our team at GP Hero still has that link in our chat box. Take 15 to 30 minutes of your time. You've already spent 45 minutes with me this morning. What's a 30-minute gonna do to you? You will get clearer clarity, if there's anything more clear than that, in that clarity call, and it's tailored for you. That's the promise. Now, if you are sure that you want to get a VA, if you're 100% sure that you are ready to invest, then what you can do is you can scan the QR code. This contains our ultimate VA task bank, our SOP templates, our calm finish checklist, and everything that you need to know about GP Hero, including how much it is to invest. You can just scan the code right now, or you can also visit our website, www.gphero.com.au. Now, if you're in that GP Hero Essentials, you're still unsure, you still don't have the answer that you need, then again, the answer would be the clarity call, because we don't want you to leave empty-handed. Take 30 seconds to book the call, walk away with clarity and one solid step. If your guts is saying that we need this, trust it, because that's exactly how our best clinic partners started, right here in this clarity call. Now, we can open it up. I think we still have, we're a bit over time, but I think we can, we have 5, we can have 2, 3 minutes perhaps to, for questions if you have anything. So you can drop it in the chat box right now if you have any questions about onboarding rules, tools, timelines, or just a question about whether it can work for your clinic. So any questions would really be welcome in this webinar. Okay. I don't think anybody has a question, and that's very okay. If you're just taking it all in, that's clearly fine. If any questions pop up later, again, the link still lives in our chat box, so you can ask it with me one-on-one on a clarity call. And again, it's just a reminder that if you haven't booked it yet, then you have our QR code right here, and the link is in the chat box. All right. So again, thanks for joining us today. I know how intense clinic life can be. So the fact that you carved out time for this, it matters. So if you remember one thing, let it be this: chaos isn't the cost of care. Calm is possible. Support is real. And your team deserves better than burnout. Whether we work together or not, we're cheering you on. Keep building something strong, something lasts, and something that works for you too. GP Hero exists so your clinic doesn't have to choose between care and calm. We're ready when you are. That's it from me. Take care, and thank you again.